Good morning, Sarah. It's nice to see you again. How have things been here at the zoo?
Morning, Dr. Carter. Things have been okay overall, but I'm a bit concerned about one of our camels, Sahara. She hasn't been eating well, and she seems a little off lately.
I see. I'm glad you called me in to take a look. Could you tell me a bit more about what you've noticed? When did this start?
It's been about 4 or 5 days now. She used to come to her feeding trough right away, but recently she just sniffs the food and walks away. She's also been lying down more often than usual.
Okay, that's helpful. Has she shown any other changes in her behavior? Maybe drooling, grinding her teeth, or seeming uncomfortable when chewing?
Yes, actually. Yesterday, I noticed she was chewing more slowly, almost like it was painful. I checked her mouth as best as I could, but I didn't see anything obvious.
That's good observation. Sometimes camels can develop dental problems or mouth ulcers that make eating difficult. Did you notice any swelling around her jaw or face?
No swelling, but she's been a bit reluctant to let me touch her head recently, which isn't like her.
Okay. And how about her stools? Have they been normal in consistency and frequency?
Not really. They're drier than usual, almost hard pellets. She's passing smaller amounts, too.
That suggests she might be a little dehydrated or not digesting properly. Has her water intake changed at all?
Now that you mention it, she's been drinking less. I thought it might be because the weather's cooler lately, but maybe that's part of it.
It could be. Camels are very resilient, but changes in diet, weather, or even stress can throw them off balance. Have there been any recent changes in her feeding routine or the type of food she's been given?
We recently switched to a new batch of hay. It looks similar to the old one, but maybe the texture's a bit rougher. Otherwise, nothing else has changed.
That could definitely contribute. Sometimes a tougher batch of hay or a change in the mineral content can irritate their mouths or digestive tract. I'd like to do a quick examination to check her mouth, teeth, and hydration levels, if that's all right.
Of course. Do you think it's something serious? I'm a bit worried. She's usually our most active camel.
I completely understand your concern, Sarah. Based on what you've described so far, it doesn't sound too serious, most likely a mild digestive upset or a dental issue. These are quite common and very manageable when caught early, like now.
That's a relief to hear. What exactly will you check for during the exam?
I'll gently look inside her mouth to see if there's any sign of sharp teeth edges, ulcers, or trapped food. I'll also check her hydration by assessing her gums and skin elasticity. If everything looks fine externally, I might take a small stool sample for lab testing just to rule out parasites or bacterial imbalance.
Okay, that makes sense. Do you think she might need any medication?
Possibly, if I find any mouth irritation, I can apply a mild antiseptic gel and recommend a softer diet for a few days. If her digestion seems sluggish, I might prescribe a mild rehydration and digestive support solution, nothing too invasive.
That sounds reasonable. Should we separate her from the others while she recovers?
Good question. I'd recommend giving her a bit of space, not full isolation, but maybe keeping her in the adjacent pen during feeding time so she doesn't have to compete for food or water. Monitor her closely for the next few days, especially her appetite and activity levels.
Got it. I'll do that. Is there anything else I can do to make her more comfortable?
Yes, try offering her softer feeds for now, like soaked hay or some alfalfa pellets moistened with water. Also, ensure she has easy access to clean, fresh water throughout the day. If possible, you could even add a pinch of electrolytes to her water to encourage her to drink more.
That's a great idea. I'll do that right away.
Perfect. And please keep a short log of what she eats, drinks, and how active she seems. I'll come back in 2 or 3 days to review her progress and decide if any further treatment is necessary.
All right, I'll start recording everything today. Thank you, Dr. Carter. You've really put my mind at ease.
You're very welcome, Sarah. You're doing an excellent job looking after her. Catching these changes early really makes a difference.
Thanks. I just hate seeing her like this. She's such a gentle animal.
I know, and your concern shows how much you care. I'm confident she'll bounce back soon once we adjust her diet and hydration. I'll send you a short summary of today's findings and recommendations by email this afternoon.
That would be great. Thanks again, doctor.
My pleasure. Give Sahara a gentle pat from me once she's comfortable, and I'll check in soon. Take care, Sarah.
You too. Bye for now.